I'm Dr. Keith Ryan. I'm a chiropractor in Tulsa, Oklahoma. I wanted to speak to you today about hand pain and carpal tunnel, something I see fairly often in my practice. First, I thought I'd show you a little bit about the anatomy of the hand with a model that I have here. Most people are fairly familiar with their hand because the skin really lies right on the bone, so you can really see what's going on here. But kind of an interesting thing, there's two bones that come down the arm here, the radius and the ulna. They connect to 9 carpal bones, which are in the wrist, right across here, and then your fingers come up across through there. The carpal tunnel itself is formed by a tunnel that comes through the carpal bones. It's about the size of your finger, and through there a nerve comes, a blood vessel, and all of the tendons, and then it's surrounded by this thick sheet that holds it all together, which doctors have called a retinaculum, that surrounds it all across there. When I'm working on hand or wrist, what I'm doing is I'm adjusting several things. I'm adjusting the elbow, if it's out of place because the radius and ulna connect to that. I'm adjusting the carpal bones and the radius and ulna on the end as they articulate with the carpal bones. Now, if somebody has carpal tunnel syndrome, I'm working on several instances here, several things. I'm working on reestablishing the curve in the carpal bone so that there's room for the nerve and the tendons and the blood vessels to go through there. I'm also working on elbow, shoulder, and neck, because along the course of the medial nerve, which is the name of the nerve that comes through the wrist, it can be pinched in any one of those places: neck, shoulder, elbow, or wrist. If it is, then it's called a double crush or triple crush or quadruple crush. And that, having pressure along the nerve in multiple places, can give you the carpal tunnel, whereas you can alleviate wherever it is and the problem goes away. If it's just in the wrist, traditional carpal tunnel, then we'll reform the wrist so that there's room to come through there. The surgical means of doing that is that they're going to release this retinaculum, meaning they're going to cut it and open that up so there's more space there. What I'll do is form the bones back around it where there's more space, and it's really highly effective and fairly easy to do across there. If you have wrist pain, wrist can be out just for the same type of things and similar, that the elbow or the wrist, adjusting the radius and the ulna and adjusting the carpal bones. You can also have hand pain through the fingers up across here, and any of these joints can be out of place, or any of these joints. You can have jams across in any of those, and we'll just release those jams and get those moving across there. Interesting thing about hand pain is it can happen through really several different causes. The carpal tunnel can happen from repetitive stress, is where you're doing the same thing over and over and over again. It can happen from vibration. It can happen from riding a motorcycle. You can have the hand pain from hurting the elbow. People sleep on it and come in and they have different problems. And you can get the finger pain from as simple as just jamming the finger on something, just a bang or a fall. Can set the fingers in place. People fall with the wrists out and jam the wrist according to that. And all those sort of things are things that we work on. If I can help you with any of your problems in the future, I'd be happy to do so. You can always contact me by email, or you can contact me by phone. You can come in the office. Thank you very much.